find that the traditional approach is still valid in many ways. It's not something that we've, just because we've come a little bit farther, that we've been able to say, you know what, that's not important anymore. We still have very key elements. You know, Belmont still rings loud and true. The respect for persons is something that, as people are trying to take a little more control in what's happening in their lives and what they're responsible for, the respect for persons, I think the autonomy issue really comes to the forefront still. When we're looking at the different challenges that we're now facing, it's how do we find a way to make that autonomy, that respect for persons, even the justice in appropriate selections, all of that still comes into play, but it's a manner of how does that look now? You know, we talk about the different financial inequities, we talk about the different cohorts of people that we have living in our communities. You know, how has that changed in the last 40 years? You know, working in Springfield, Massachusetts right now, we're talking about the new casinos and so forth coming in. You know, what does that look like for research, and how do we still apply the elements? It's not going to be the same application as it was, because it has a new identity to it. It's a different group of people you're trying to get that message across to. It's a different different perspective that they have. You know, in our community, it's unfortunately one of the poor communities in the nation. We're dealing with a growth in our homicide rates. We're dealing with a growth in drug addiction. That's been a really big issue for us the last couple of years. And yet, with the changes in healthcare and the funding of healthcare, we're not finding that we have the facilities to really take care of that, or the expertise to take care of that. So we're having to look outside and find ways to build those teams to now address that. And now it's a whole nother group of people to educate and bring on board with what does the ethics look like? How do we build that forward to address the new struggles, to address the new challenges, and how does it get applied? So the foundations, I think, are still applicable, but the application of them is very different.